This happy little baby has no idea she's running out of time. 1-year-old Helen Dixon desperately needs eye surgery to correct her vision. Because of COVID, that surgery has been delayed.
She needs that before her second birthday to avoid any lifelong issues with her vision. We have no word as to when that's going to happen yet.
The pandemic has pushed back more than 500,000 surgeries across the country, and not all patients have seen the same impact. Over the course of the pandemic, hospital admissions for pregnancy and delivery remained about the same, while admissions for major cardiac diagnoses saw a bit of a drop. The largest decrease by far was for patients needing hip and knee replacement surgery.
The orthopedic surgeon I talked to said, well, you'd be 3 to 4 years.
Wow.
And I just deemed that to be unacceptable.
I'm in British Columbia. I need knee surgery, and I've been waiting since June to have a date scheduled, so I'm not sure how long I'm going to have to wait.
For Graham Dixon, what his daughter needs is clear. He just hopes she'll get that surgery before it's too late.
Durham's smile was the focus of photographs, a stark contrast to the picture today. Durham's cancer now impossible to miss and spreading fast.
If I don't get the surgery, it's going to be going into my brain and my eye.
That surgery, scheduled for this week, canceled as Durham drove out from Saskatchewan because of Alberta's overwhelmed healthcare system. The 54-year-old left in limbo.
I don't know. It's such an invasive cancer. I hope this next surgery gets it all. It's just because it's insidious. It creeps around, right?
Across Alberta, similar scenes are playing out. The province's ICUs jammed with COVID patients, forcing the cancellation of surgery.
Currently, 90% of the people filling up the hospital beds are those that are not vaccinated. And we've got people all over the country, in fact, all over the world, demonstrating because they don't have the freedom to keep me from getting my operation.
It's awful because I'm not an angry person, and I've become so angry with the unvaccinated, with our government.
Waiting for surgery can tell you how stressful that time is. But now dozens of Albertans scheduled for orthopedic surgery, things like knee and hip replacements, they're left waiting again as 4 ORs are closed here at the Royal Alexandra Hospital over staffing concerns. 53 patients had their surgeries rescheduled as the operating rooms closed for 3 days due to staffing concerns. Alberta Health Services saying they have the surgeons, nurses, and anesthetists, but no doctor to take care of the patients during recovery, specifically overnight. But this doesn't impact emergency orthopedic surgeries.
Our healthcare workforce is tired. They've worked extremely hard and they've done the best they can to serve Albertans. And we have limits as humans.
The Edmonton Zone Deputy Medical Director paints a picture of fatigue on the front lines as the pandemic continues, leading to not being able to fill vacations or vacancies. Just look at this status map. Each yellow marker shows an Alberta hospital with some form of closure Tuesday.
So what about our freedom to access timely and appropriate professional healthcare services?
This is a photo of an Edmonton man's brain tumor that's gaining thousands of retweets as he says his surgery was canceled indefinitely. And he's not alone. Non-urgent and non-emergent surgeries have been postponed in hospitals like this one across the province in order to increase capacities in ICUs as COVID cases continue to surge. Dave Mathers has a chronic kidney disease and has been on dialysis for years. A year ago, he started testing for a kidney transplant from an anonymous donor and was on track to have a new organ by September 8th. He was devastated to discover his surgery was canceled.
For certainly many years, I've been hoping for this, and it was just taken away in a second.
Rhonda Vance's 7-year-old son needs surgery for his relapsing bilateral clubfoot. There were plenty of tears when they were told Friday's surgery was postponed.
It was frustrating. My son was very upset. He was quite sad because he's in pain.
Vance's son Keegan feels pain when he walks because his right foot is twisted inwards and he has to walk on the side of his foot.
We had him in baseball earlier this year, and it was really hard to watch him struggle to run with the other kids. He did it, but he paid the price afterwards because he was in so much pain.
Alberta's Chief Medical Officer of Health, Dr. Dina Hinshaw, said in a press conference Thursday that in the past 4 months, 84% of the people who died due to COVID were not fully vaccinated. As someone whose surgery was pushed to make ICU room, Mathers wants people to reconsider refusing the COVID vaccine.
I don't think anyone that doesn't get a vax is out there trying to stop someone like me from getting my kidney, trying to cause these. I don't think they're trying that, but they have to understand this is the consequence of them not taking, the proper action.
As of Thursday, there are 154 COVID patients in the ICU in Alberta, and no word on when patients with canceled non-urgent surgeries will be able to reschedule.
We have not made it illegal for people to be unvaccinated. We've made it inconvenient for them to be non-vaccinated, and we have left them with the freedom to choose whether to vaccinate or not, no matter what it means to others.
A Wellpinit woman who had a mastectomy last week is now waiting indefinitely for reconstructive surgery. It's just one of the many impacts of elective surgeries getting canceled during the latest surge of COVID-19 cases. KRIM 2's Amanda Rowley shares how frustrating this situation is for breast cancer patients.
Waiting is never easy, but it's even more difficult when your health is on the line.
I don't know what kind of wake-up call it takes, but a lot of people sure need surgeries about now.
Donna Julik was diagnosed with breast cancer in June. She had a mastectomy last week. She was prepared to spend the next several weeks recovering.
It's like a therapeutic thing for me to do art. I knew I'd be not doing much for about 6 weeks.
She was supposed to get reconstructive surgery today. Doctors would have also taken out additional tissue so that she would be cancer-free. But it's considered an elective surgery, and now she is waiting indefinitely.
If we wait too long to get that piece out, then I have to do radiation. So the whole point of the mastectomy was to not have radiation or chemotherapy.
Donna says this kind of waiting is harder than the mastectomy.
It's frustrating because in my mind, cancer's bad and you want it to go away right now. And it's always been that way, hurry up and get that taken care of and then we'll be done with it. And so to wait, it's a little nerve-wracking.
What do you think about that? Just the way that COVID and the surge of cases and just the status of our hospitals being stretched so thin that surgeries like yours have had to be put on the back burner.
Yeah, it's a two-sided sword. I feel really bad for the people that have COVID and are in there, and because it must be miserable. I imagine it's miserable to have a tube in you helping you breathe. I'm hoping that the families that have people in the hospitals go and get a COVID shot because it's real. And nobody wants to be sick.
Number of British Columbians in hospital with COVID-19 has topped 500, and now more elective surgeries are being canceled. CTV's Penny Daflos is on that story, and Penny, today we learned the government is canceling more than 1,700 surgeries.
That's just over the next 2 weeks, and that's just in the Metro Vancouver area. And we have to emphasize that is on top of surgeries that have already been canceled, which the health minister acknowledged today. So I asked Fraser Health earlier this week. They told me they've had about 50 to 70 surgeries canceled. Vancouver Coastal Health would not tell me how many surgeries they've canceled so far. And the Ministry of Health tells me they will try to get that information, but hasn't made it available yet. As we reported earlier this week, several hospitals are at full capacity. And now staff that typically perform surgeries are being reassigned to staff what the health minister calls surge capacity beds. These are extra beds that can be in hallways, waiting rooms, even shower rooms to care for COVID patients. As a result, Abbotsford General, Lionsgate, Burnaby General, Surrey Memorial, Royal Columbian, Richmond, St. Paul's, UBC and Vancouver General Hospitals are all postponing non-urgent, non-emergency surgeries starting Monday.
for those patients that have already been called or will be called to postpone their surgery, and for patients whose surgery we aren't able to book at this time, I make the same assurance we made to patients last March. You will not be forgotten. You are part of our surgical renewal commitment, and as soon as we are able to do so, we will call you again and rebook your surgery.
The health minister expects the non-emergency surgery postponements in Metro Vancouver to last about 2 weeks, but says they will be reassessing every week to see how it goes. Remember, our current COVID hospitalizations are already in the worst case scenario territory outlined by the province in early
approached about 10 different trucking companies to ask them for their stats, real stats. So I'm going to, in this video, talk about our stats, and I'm going to talk about 4 or 5 other trucking companies with their stats on actual truck drivers. So how much % of their fleet is going to be walking away from the industry, or what are these drivers going to do? First, let's get into the stats. Let's talk about these trucking companies. So I'll introduce them one by one. ET Transport will be one of them, but let's talk to other trucking companies. These are either the presidents, the CEOs of these companies that gave me their feedback and data and allowed me to share their information with you guys. So the first company that I've talked to is Trans Am Carriers. They're a carrier here in the GTA. Approximately, they run about 100, 125 power units. So here is the email. I've blocked off a lot of some information, but the most important information is there. Approximately what % of your fleet is not vaccinated? And the answer to that question is 10%. How many cross-border drivers are you going to be losing, or you're going to need to shuffle within your organization? So what they're doing is they're reshuffling the drivers that are not vaccinated and putting them into a inter-Canada role. So not cross-border, they're going to be doing Canada-only positions. Now, luckily for the drivers working for this company, they are able to give them the ability to work within Canada. Most companies that I've talked to, and you'll see throughout this video, they don't have this option. So luckily for the carriers at Trans Am, that they're able to give them roles within Canada and not lose these drivers. The drivers that will not get vaccinated, what are their plans? Are they leaving the industry? So a lot of the articles that I'm reading, they're talking about so many drivers leaving the industry. Well, is it really true? Because I've asked these companies all to comment on that. So from the 10% or the 10 drivers that are not vaccinated, the answer is that 2 have left the industry. So here you go. So our first company, the actual stat is 2% have walked away from the industry. Now let's get into another company. So the second company is Mackey Transportation out of Whitby, Ontario. So I sent them the exact same email. I talked to them on the phone and I've asked about their stats. So Mackey Transportation out of Whitby, Ontario, their numbers came back at 5% are not vaccinated. So I don't know the size of this fleet. What I do know is that 5% of their drivers are not vaccinated, and we'll just leave it at that. So company number 3 that I've talked to is Pentagon Logistics out of Mississauga, Ontario. So they run a fleet of about 35 trucks, and in his email back to me, they're currently experiencing that 25% of their fleet is not vaccinated. What in the world are you supposed to do in this situation? I have absolutely no idea. So let's go into another company called Westway Group Canada Inc., based out of Concord, Ontario. So approximately what % of their fleet is not vaccinated? And the response to that is 10%. So they run about a fleet of 45 power units. 10% of their drivers are not vaccinated. What are they planning on doing? The unvaccinated drivers, the drivers are looking for new Canada-only positions. And here's another company, Seafood Express out of Charlottetown, PEI. So they're running about 75 drivers, and they have 4 that are not vaxxed right now. What are they going to be doing? Well, a couple of them are going to be walking away from the industry, and then the other 2 are most likely going to be looking for local positions or Canada-only positions. So there you go. So here, last fleet I'm going to talk about is our own fleet. So here, ET Transport, we had in November, 4% of our drivers were not vaxxed out of 100. So you can do the math, it's 4 out of 100 that were not vaccinated. As we approached closer to the deadline, 3 out of the 4, actually 4 out of the 4, went and got their first and second shot. Today in our fleet, we have 1 driver that has gotten his first shot, and he's had a reaction to that first shot. So he's pending, but the other 3 drivers have gotten both of their shots. So we're sitting at 1% right now that's not vaccinated, and we are hoping that the US is going to change their mandate that Canadian drivers will be able to go into the US without being vaccinated. I mean, if you think about it, really, I mean, these truck drivers have been on the front line since the beginning of this pandemic. It's been 2 years that they've been sacrificing themselves and going cross-border and putting themselves at risk out there while everybody was home, everybody was in lockdown.
These arguments that there 2 years ago truck drivers were allowed to cross the border are so lame, since 2 years ago we did not have vaccines.
Alberta Health Services has cancelled all non-urgent surgeries in the province because of a surge in COVID-19 cases. Now with this next story, BCN's Naveen Day speaks with patients who are frustrated about facing more delays.
It can take months or even years to have your non-urgent medical procedure scheduled. So imagine the dismay you would experience if you were called and told that your surgery has been postponed indefinitely. That was the sad reality for many Albertans recently. And last week, I spoke with 2 Lethbridge residents who say they have lost their scheduled procedure dates.
I was due for hip replacement on my left hip on Monday of this week. They said that elective surgery was cancelled until further notice.
I'm having to have steel rods put in my upper legs. Been waiting over 5 years now for these surgeries. About 2 months ago I had my first one on my left leg, waiting on my second one. I went in about 2 weeks ago up to Calgary to the surgeon where I was appointed at, and now everything's being put on hold.
Both Wilson and Ross were told over the phone that their procedures, which required overnight stays, were cancelled in order to free up beds that may be needed due to a rise of COVID-19 cases. While they understand that things can get delayed during a pandemic, they are frustrated that they have to keep their lives on hold.
I'm very frustrated. It's just, I'm trying to get myself fixed up, trying to get myself better, trying to make my own life better, and it's just this COVID thing is just holding everybody back.
It took a year to get in to see for a consult, and then it's taken now till another year to get a date. So of course I am frustrated now because of course we don't know how long it will be before I'll be rescheduled.
The situation, he says, no hospital or patient wants to experience, which is why he's urging the public to get vaccinated.
Getting a vaccine is an act of caring and loving for your community, for your family, for your healthcare system, wherever you live.
Children's has hit a critical point. The hospital is not only postponing elective surgeries, but in some cases even turning away patients when there aren't any beds available. Now, the impact extends beyond patients who have COVID. It's affecting children who don't have COVID from getting the medical care that they need.
7-year-old Felicity Fruget has a smile that can light up any room. Lissy has moderate cerebral palsy. She can't walk, talk, or eat by herself. Things got scary when she was recently hospitalized with RSV and couldn't eat for 5 days. Lissy now needs a feeding tube. She was scheduled to have the surgery at Cook Children's next week, then it got postponed. Cook Children's stopped elective surgeries due to the COVID surge until at least October 11th.
I was just disappointment from so many different levels.
Hospital leaders say they didn't come to this decision lightly.
This is a very serious decision, very serious evaluation of what may continue and what may be postponed.
The Dallas-Fort Worth Hospital Council says Friday there were only 4 available pediatric ICU beds in North Texas Trauma Service Area E, an area with a population of more than 8 million people.
Say life and death consequences now. It's not an exaggeration for families like ours anymore.
In Fort Worth, I'm Adriana De Alba.
Have people forgotten these images of bodies being loaded into refrigerators in New York?
Washington, thousands of people are getting phone calls now and learning the surgery they've waited months to get is canceled. They're being canceled because the hospitals are full of mostly unvaccinated COVID patients. The surgeries are called elective, but they're not to those who need them. We thought that you should hear from some of those people. Oregon's major hospitals do hundreds of surgeries a month in normal times, but of course, these are not normal times. Hospital space is tight and reserved for emergencies and COVID patients. That means people like Paul McElhenney, a school bus driver who lives in Tigard, has to live with his knee pain.
My knees are totally bone on bone, kneecap bone, so that's what's tough.
His knee replacement surgery is on hold. Christy Finn of Milwaukee needs surgery on her stomach.
Basically, my stomach is dead. And so they're going to have to remove it. And I've been on a feeding tube since April. I can't have any solid food. It's all got to be liquid.
Her surgery also on hold. She's losing her sympathy for those who will not get vaccinated. The majority of people currently hospitalized in Oregon for COVID are not vaccinated.
I'm frustrated. You know, it's all could have been, it's preventable. It's preventable. I mean, at first I was very sympathetic and I'm sorry that people are sick and that they're dying, but there's others of us out there that I'm immunocompromised. I mean, I have other conditions going on.
Barb Russell in Central Oregon has a racing heart. It's called AFib.
AFib is when your heart beats irregularly and the blood then coagulates into the atrium. Then when the heart finally calms down and gets back to normal, it can pump out blood clots. And those can cause strokes, death, whatever.
Her procedure also postponed until, well, she's not sure when. After the COVID surge quiets down, probably.
Yes, it upsets me that people are protesting, don't get vaccinated, don't wear masks. Well, I'm sorry, you're messing with my life. So I'm bitter.
You are probably noticing a pattern here, and truthfully, we could keep going. Melanie Johnston from Cornelia spent 2 years searching for a solution to her lower back pain. It was going to be surgery until it wasn't. And Sherry Young, who needs a hernia operation to relieve her pain. When you hear about elective surgeries, this is what we're talking about. They are 5 of thousands around Oregon, suddenly shut out of surgeries that would relieve their pain and suffering, the victims of others' choices, and they are not happy.
I feel I've done everything right.
The pain is impacting my life. It's preventable.
People are just not educated on the situation.
It seems like it's impossible. I don't know. It is frustrating.
As you'll know, 9 months ago, on March 16th, 2020, we postponed non-urgent scheduled surgeries to ensure our hospitals had the capacity for COVID-19 patients. We resumed non-urgent scheduled surgeries on May 18th to 111,584 patients who were on wait lists before May 7th to ask them if they were ready to reschedule their surgeries. We said that we would start scheduled surgeries on May 18th, and we did. Between May 18th and November 12th, 163,696 patients received their surgeries.
For obvious reasons, I want to see this pandemic come to an end. I can then get my surgery, start to walk instead of ride in a wheelchair, and I can begin to relive my life again. But we all must remember, we're all in this together. And we're all inconvenienced in one way or another. However, I cannot support the truckers. They have the freedom to get a vaccination or work in Canada or work in only the United States. They are the least of all the people that I'm worried about. They're fully able-bodied and able to work, and they've been able to work entirely through the pandemic. There are many people who have businesses that can't work, don't generate any income, and in fact pay rent without being able to have any customers. In fact, the truckers may be the least affected by this pandemic. So take care, look after yourself, do what you can to keep from spreading this disease, and let's get on with our lives.